pediatrics is obviously the best nursing specialty, and I'm not biased at all. Kids are seriously the most resilient patients and bring so much joy to the hospital. I mean, seriously, do you blow bubbles and belt out Disney songs at the top of your lungs in adult land? I don't think so. No, case in point. But when I first started in pediatrics, even though I absolutely knew that is where I wanted to be, it was scary. It can be really tricky because the patients aren't able to communicate well, if at all. There's parents thrown into the mix, and little bodies tend to be so sensitive to even the tiniest little changes, making them really prone to decompensation quickly. But never fear. In today's video, I'm going to share with you my tips and tricks for working in pediatrics so that when you walk into your new clinical job, whatever it is, you can do so with a little bit of extra confidence in your back pocket. If you guys are new here, welcome. I'm Liz. I'm a family nurse practitioner, but before that, I was a nurse for years, and 4 of those years I spent as a pediatric cardiology nurse, and I absolutely loved it. Introduction's done. Everyone else, welcome back. Now let's talk about my favorite topic ever, pediatrics. The first thing I want to talk about are the patients themselves. Who will you be taking care of while working in pediatrics? So peds is usually all the patients in the hospital that are 18 years and younger. Some hospitals will allow children, young adults who are 21 and under to continue to be seen at the children's hospital if they've been seen there their whole life. Either way, even though it's not a huge age range to be taken care of, the developmental range is enormous. The needs of your patients will obviously be vastly different based on their age and where they are developmentally. So the very first thing you're gonna have to work on when working with kids is just being adaptable and super creative in your approach to getting things done. You're really gonna have to make sure you make plans based on your individualized patients each and every shift. It's not gonna be one of those jobs where you can go in and do X, Y, and Z in the same exact order you always do every single time, because that's just not gonna fly here. Let's talk a little bit about creating your plan when you first go in at the beginning of the day. Like I said, you're gonna wanna make plans for each and every patient based on the patient group that you have that day. So let's say you get there at 7:30 in the morning. Does your 17-year-old patient really wanna be the first one you go see at 7:35 to go in, wake them up, do their assessment, go on a walk, get their vitals? I don't think so. But his neighbor, who is 1, has probably already been awake for 2 or 3 hours, and that would be a great place to start, because he won't mind at all if you come in and get all his stuff done, because he's wide awake. Thinking of things like that is gonna be super helpful for you. And what goes hand in hand is you're gonna wanna create plans and tactics based on the patient's age and developmental level. It would be a super good idea before you get into these clinicals or job to go find your resources you had from peds, flip through them, and look at the developmental stages. I'm not talking like Piaget and not like all of that, but just like, what do kids do, you know, when they are 6 months old, when they're 2? What are they motivated by? What kind of play are they super interested in? Things like that. Can they grasp the concept of bartering and bargaining, or is that gonna be wasted on them? So Google a quick refresher on that and kind of integrate all of those developmental stages into the plan and the care that you give those kids. Here's a couple of examples for you. Kids who are like 3 to 6 would probably absolutely love to help you in any way that they can. And they're gonna be a lot more cooperative if they can help you. So let them take the blood pressure cuff off. Have them help you put the pulse ox on. You wanna hold a bouquet of your meds while I kind of scan them here? You wanna help me scan them? Oh, you can get a lot done if you let kids scan things. Slightly older kids, have them write for you on the whiteboard. What is their weight? Have them write their schedule out for you. Things that they can do at that level. Have them show off their skills by helping you. But keep in mind, these tactics will not have the same effect on teenagers. They won't be amused by this. Side note, I'm just gonna throw out there, 1-year-olds, really like 9 months on, they're just gonna hate you pretty much no matter what you do. Just accept this. You're just gonna wanna go in, get everything done, and escape as quickly as you possibly can, because stranger danger is real here. If you work nights and you're planning your day, teenagers are gonna be able to stay up later than your toddlers or your young kids. So hey, ask them. Give them a little bit of autonomy. Say, hey, do you wanna do all of your meds, everything a little bit later after these kids go to bed? And they're gonna appreciate, one, that you gave them a choice and are involving them in their care. And it's easier for you because you don't have to get everything done at 8 o'clock. So hopefully those examples kind of showed you how I like to tailor some of my care to different age groups and developmental levels. It's something I can't stress enough the importance of when you're going into pediatrics, just to make your day go a little bit smoother. The next thing is cluster your care. Now, obviously when you're working with adults, you're trying to cluster your care, but this is a whole new level when we're talking about kids. Humans, for the most part, I have found, are very routine oriented and based. I know I have my definite morning, daytime routines, and if I don't get my coffee and my yogurt by 8:30 a.m., I am prone to some drama. But if by some horror I don't get that accomplished, 80% of the time I can handle it because in my maturity, I have learned the ability to cope. Here's the thing though, kids don't have much ability to cope. And babies and teenagers, they just can't cope at all. Sorry if you're a teenager. I was there too. Coping's hard. So now you have children that really can't cope and a new scary situation. I think it's easy to forget that being in the hospital is a really scary thing. I get scared and I'm almost 30, so I can't even imagine how these kids are dealing with it, and they're 3. Their entire routine is thrown off. They're in a totally new situation. They're sick. Therefore, their ability to cope is pretty low on the totem pole, and whether you like it or not, you are a scary thing because you are part of this new environment. So you're gonna wanna kind of come in, get everything done, make the traumatic experience as quick, easy as possible, and then bounce. And if you get everything done, your assessment, your vitals, your meds, your incision wound checks, all of that done at one time, then later, when they've calmed down, you can come back in and you can be the fun, silly nurse that's playing around with them, getting to know them a little bit, distracting them, offering other comfort measures. And that'll also help teach them that, hey, every time Liz comes in, she's not coming in to do something mean to me. You know what I mean? It gives you a little bit of a good cop going on. So even though it seems like it might be a good idea to go in and do like little chunks at a time, not to overwhelm them, I've honestly found in my experience, go in, get it all done at once. Just get the drama over with, and then bounce. Another super helpful thing in order to get things done is ask the parents for their input. I've been on the opposite side of this thing when Avery's been in the hospital, and let me tell you, it is terrifying as a parent to have your kid in this situation. You feel like you have absolutely no control. So usually when I'm going in and I'm trying to make my plan, I'll go into the room and I'll introduce myself to the parent, obviously the patient as well, and then I'll ask the parent, like, what does their usual routine look like? I'll lay out everything that I have to get done that day. You know, I'm gonna have to get vitals every 2 hours. I'm gonna have to do this dressing change, this, and this. We're gonna flush the IV, we're gonna do these meds. Here's what we have to do. Do you have any preference on how some of this gets done? Obviously, you can't tailor your entire day to these parents' preferences because you would never get anything done. But if they have something that they do every day, like a routine, like every day at 8 p.m., Susan gets a bath. Cool, Susan can get a bath at 8. I think we can make that happen. If they like to do things in a certain order while you're in there, sure, why not? Doesn't hurt me. But parents know their kids best. They're gonna like being involved. Going in and just asking them, laying everything on the table and asking for their input is really gonna go a long way in terms of building a relationship with them and making your day go a lot smoother. Your best helpers on this floor, don't forget, are the parents. Okay. So now we have a plan with our patients. We've gone in, we figured out how our day is kind of gonna look, how we're gonna interact with them, and what order we're gonna do things in. Let's talk about how you are going to get the actual tasks done. How you're gonna do things like do your assessments and give meds on kids that really don't like you. Fortunately, there are definite tricks, and I will share all the ones I can remember with you. Let's talk about doing your assessment. So, when you're doing your assessment, you're gonna wanna do the easiest, least bothersome things first. You gotta get them warmed up to you. When you're going in initially, avoid anything like their mouth, their ears, any tubes coming out of their body, dressings. Oh no, we do not start there, my friends. You're gonna start like at their toes. You're gonna ask them, how many toes do you have? Can I count them? You're gonna count their toes. While you're down there, feel their pulses, check their cap refill, see how their feet are looking, then move up and maybe ask to listen to their bellies. While you're listening to their bellies, see if you can guess what food they ate for breakfast or lunch. They always get a kick out of that. And then once you've listened to their belly, you gotta feel it. So you have to make sure you can feel the strawberries they had for lunch in there, right? Go feeling around in there. Tell them you can totally feel the strawberries, but you do hear something kind of weird and ticky up in the other end of their chest. You better go check that out. Go listen to their heart. While you're listening to their heart, maybe they wanna listen to your heart. Offer them that option. And while you're there, listen into their chest, listen to their lungs, count their respirations, count their heart rate. Kill 2 birds with 1 stone here. If you're in a provider role and you have to look in their ears, I think I might see a jelly bean in your ear. Can I look? Or do you think I can shine this light all the way through your head? That sometimes works. Just you're gonna come up with creative ways. It can't just be like, I'm gonna look in your ear now. I'm gonna push on your tummy. They're not gonna respond well to that. Just remember, everything in pediatrics goes so much better if it's an interactive activity, meaning you're interacting with the patient, but you're also talking out loud, interacting with the parent. While you're doing the assessment, you're looking at their toes, you're saying, oh, this looks good. I'm just checking their circulation to make sure they're sending blood to their toes. I'm listening to make sure they have belly sounds. I'm listening to their heart to make sure it sounds healthy and their lungs sound clear. Just talk literally out loud everything you're doing while interacting with the patient, and that's gonna make the kid happy as well as the parents happy. And even if it's a small baby where you wouldn't think you have to talk to them, talk to the baby for the parent's sake. There is nothing worse than being that parent sitting in the chair next to the bed while the nurse is silently poring over this small human you love so much and they're silent. That's just the worst and so uncomfortable. So at least talk to yourself. I always talk to my patients. I probably always look crazy. And sometimes you're gonna have to look at things that they don't want you to look at. Just remember that. You're here to promote their health and well-being. So you're gonna have to look at that chest tube. You're gonna have to sometimes do things like change PICC line dressings. They're not gonna like it. There are going to be tears, but just remember to yourself that you are trying to do your best for their health. Get in, get out, do it last, and then bounce. Vitals, which seem like you never think vitals as being like a task to overcome until you've worked in peds. And it's like trying to wrangle a monkey who just ate like a full bag of sugar and you're just like, what is happening? I just want your blood pressure. Here's a few tips on how I have kind of gotten vitals to work sometimes. And they're not always gonna work, guys. You cannot always get vitals on kids if they're getting better. It's just not gonna happen. So with vitals, you're gonna start with the same idea you did with the assessment. Least bothersome to most bothersome. So least bothersome is gonna be like putting the pulse ox on their finger, checking their oxygen stats. You should have already gotten their respirations and their heart rate while you're doing your assessment, so that's already done. And then in young kids, you're not gonna ask, where can I take your blood pressure? You're gonna say, hey, which arm or leg can I give you a hug on? And you're gonna whip out the blood pressure, it's a hugger. It's not a blood pressure machine, okay guys? It's a hugger. And then you can give them the option, as long as that's okay for them as a patient, pick an arm or a leg, not can I, just pick one. It must be done. Sometimes legs are easier. You'll do legs on small babies up to like when they're toddlers. Sometimes legs are just easier, especially if you're getting vitals in the middle of the night, you can just slip it on their leg and inflate it. In a really fussy kid, sometimes having the parent hold the child, like the toddler, while they're getting their blood pressure can also work wonders. And you're always gonna wanna save the temperature for last. I don't know why, but sticking that thermometer probe under a child's armpit is like the equivalent of stabbing them in the eyeball with a fork. Let's pause for a second, because in case you didn't notice, the language in pediatrics is different. Let's take a quick look at what I'm talking about. It's not an IV, it's an arm straw. And you're gonna wanna flush those things while they're sleeping, like real sleeping, if you can. If not, kind of make a game out of it. Explain, hey, this is salt water I'm gonna be pushing through here just to make sure the plumbing in your arm straw still works. When I push it, can you taste the ocean? Can you smell the ocean? You wanna help me push it? Whatever makes them happy. You wanna put the little cap back on? Perfect, cool. And I don't know what IV fluid is, but I sure do know what superhero juice is. And you need an arm straw to get the superhero juice. That's why I can't let your arm straw out, kid. That's why. And a kid probably will not get on a scale if you ask them, hey, hop on here, I wanna weigh you. But if you ask them how much bigger they are since yesterday and bet them that they haven't grown at all, most children will hop on that scale for you and take that bet. Sometimes they won't be scared of the pulse ox if you point out that it's gonna make their finger glow like an alien. And anytime they're gonna get an IV, a needle, anything like that, it's not a shot, it's a poke. It doesn't really help, but that's just what we call them. And I tell them, don't lie to them, it stings. And then it'll go away. You are so brave for doing this, good job. I mean, there's probably going to be tears. Implement whatever developmentally appropriate intervention there is. Maybe you have child life on your unit and you can kind of have them come in and give some distraction items. Pokes stink. Don't beat around the bush. Don't say it's not gonna hurt when it is, because I mean, kids are smart and they're gonna learn real quick that you lied to them. And just a fun thing to do no matter what is if they have like a stuffed animal or a doll, something that they really love, and you have a few extras on your unit, give the doll a blood pressure cuff. Check the blood pressure cuff on the dog or the doll before you check it on them. It just kind of helps normalize things for them and makes it a little bit less scary. All right, well, that was a fun detour. Let's get back on track. What were we talking about? Tasks, medicine. Giving kids medicine can be really tricky. I actually made a video a long time ago on how to give babies and toddlers medicine. You can go check it out if you're curious about that. I have all sorts of tricks and tips that I've used and developed through the years to giving them, because they're really the usual big issue with medicine. For older kids, you can crush or empty a capsule onto yogurt, onto ice cream. You can mix it with chocolate syrup, something that tastes kind of good. Or a really good method of getting kids to do most things I have honestly found is just to dare them that they can't do it, and they really like to prove you wrong. I have a pretty high success rate with that one. The next thing I want to talk about with pediatrics is so huge. Parents. Include the parents. A common misconception is that pediatrics is all about working with children, but you work just as much with the children as you do with their parents while working in peds. Learning to communicate with parents is absolutely essential. Explain everything you're doing. There is nothing more terrifying than having someone come into your kid's room and do something with your child, put something in their IV, and you don't know what it is. Explain every med you're doing, every flush. Just, hey, I'm popping in, I'm gonna just hang a flush for her lasix real quick. Then they know it's not that hard for you and it just puts them at ease. It's better to state the obvious than to have the parent wonder what you're doing. And sometimes throughout the course of the day, you're gonna run into things because you're in the hospital that aren't right. And parents are gonna be able to pick up on that. So if obviously you're doing your assessment, you're looking at the kid and something is changing, something is not right, tell them, guys. Do not just sit there and be like, I'll be right back, and come back with an entire team of people. Tell them, say, hey, I'm not a huge fan of how this sternotomy looks. It's a little bit pink and swollen at the top. I'm gonna come have the resident take a peek at it real quick. I mean, it's not that hard. I feel like we are so trained to try to be positive, and I don't even know, like, not want to tell people things, but this is their kid. And if you're worried about something, I mean, don't be like, I'm actually concerned that there's a huge pocket of pus under here and there's an infection, it could go everywhere and bad things could happen. No, don't go down that road, but just be like, hey, this is what I'm seeing. It's a little bit different. I'm gonna go get help. They're gonna know, guys. If you're coming in here and like looking at their kid and spending 5 minutes looking at something that everyone else just looks at for 3 seconds and is like, all right, cool, they're gonna know something's up. Communicate, communicate, communicate. Let them know that their vitals are good, that their weight is trending the way it should be, that they're having a good, their eyes and nose look great. Just communicate as much as you can. You cannot over communicate with parents, but it's super easy to under communicate. Also, when you're talking to the parents, point out the good things. Parents with kids in the hospital hear bad things all day. So it's your job to, even if you are telling them a couple bad things throughout the day, find at least like 5 good things. I found that we really forget, especially with young babies, that we really forget that this is like this parent's new baby. So this 3 or 4 day baby comes out to you, with 3 chest tubes, they're on BiPAP, they have tubes coming out of everywhere, but you tell that mama that her baby is absolutely beautiful, or that 2-week-old, you tell dad, like, he is so feisty, like, just something. You got to find something to, like, these are new parents. You got to support them and support them in their new parenthood as well. I'm telling you, there is a lot that goes on in peds that you don't even think about. But yeah, overall, I always just try to find like 5 things a day. They're silly, they're smart, they're funny, they're kind, that I have found in the kid. And I point it out to the parent just to kind of remind them that, like, hey, yeah, you're in a tough situation right now, but like, I'm noticing the good things too. I'm not just looking for the bad things, and it kind of brightens their spirits a little bit, I think. The last thing I want to point out with kids, guys, is just be so observant. Kids go bad so quickly. Make sure to double check their eyes and nose. Look for like the tiniest weird trends in their vitals. If the parent, if dad is saying he just doesn't seem like himself, look further. Look for something that may be wrong, because parents' intuition is like no other. Trust your gut. If you're sitting there and you're like, this kid just doesn't look quite right, check it out. Do your assessments. This is so hard, especially in kids, because kids take naps, they sleep. The parents really want them to get a good night's sleep or nap during the day, but you have to go in and look at that kid, okay? Even if you're getting there at 11:30 at night, you got to go in, get a flashlight even. You don't have to turn all the lights on, but you want to get light on that child and look at them. See what their baseline is. That way, at 4 o'clock in the morning when mom calls you in and says, this is different, you know what it's different from. You know what I mean? And they might be annoyed with you because that kid might wake up when you're doing your assessment at 11. They might be like, oh, they're not sleeping well and you're coming in and barging in here. And I just remind them as kindly as I can, like, I know how important sleep is, I promise. But I am responsible for your child's health right now, and I just wanna make sure I know what they look like so I can notice changes, because my #1 priority is keeping your kids safe. And almost every time, I mean, they're gonna have parents that are like off the deep end, but almost every time the parent was like, okay. They were annoyed by it, but they were like, okay. And that's something you're gonna have to learn in peds, is you're gonna have to put your foot down to advocate for your patient, because parents don't want to see their kids uncomfortable, in pain, or doing things they don't want to do. And you're going to have to be the person to implement those things. Be like, I know you don't want to do it, but we really have to. And there's always a little bit of friction there. But if you just keep emphasizing this is for your child's well-being, it usually goes okay. All right, I think those are most of my tips for how to succeed as a pediatric nurse. I hope this gave you a little bit more confidence to enter your pediatric setting that you might be going into. And I hope you love it just as much as I do. I miss it. If you guys are new here, I'm Liz. I make videos just like this one once a week and a weekly vlog documenting my journey as a family nurse practitioner. So if you're into that, consider subscribing below. I'd love to have you on my adventure. Everybody else, welcome back. As always, it's so good to see you. Let's get to that question of the day, which is, what was your favorite flavor of medicine growing up? Or now, if you're someone that still eats flavored medicine. Mine was grape. I was obsessed with grape. Grape, all things like Dimetap, Tylenol, everything had to be grape. Obsessed, closely followed by bubblegum with, what was that, amoxicillin? My jam. Anyway, excited to hear what your guys' was. Hope you all have a fabulous week and I will see you later. Bye.